Welcome, everyone, and thank you for tuning in to this virtual event, CARES Act 1 year later, Oversight of America's Investment in Pandemic Response. I'm Paul Martin, PRAC Vice Chair and Inspector General at NASA. I'm here on behalf of the Pandemic Response Accountability Committee, known as the PRAC, and the Partnership for Public Service, co-hosts of today's event. A year ago, so much was unknown about the coronavirus and how best to protect ourselves, our communities, and our economy. But over the past 12 months, the CARES Act, the American Recovery Plan, and other emergency legislation have provided more than $5 trillion in relief and recovery funds to individuals, state, local, and tribal governments, small and large businesses, healthcare, and many other sectors. At the 1 year mark since passage of the CARES Act, it's important to take stock. Who is tracking these unprecedented sums of money to ensure they're reaching their intended destination and having the desired impact? How are we ensuring transparency in this spending? Well, one of the answers to those questions is a robust oversight community led by inspectors general, the Government Accountability Office, state auditors, and a new organization, the PRAC. Here's a short video on how the PRAC is helping ensure transparency and oversight of this massive taxpayer investment in pandemic response.
A Washington state man testing positive for the deadly virus. According to the CDC, the man in his 30s flew home to Seattle last Wednesday, infected but not yet symptomatic.
The thing we're concerned about is the transmission from person to person to person. That's called sustained transmission.
Well, again, what we know is that it's spreading. That's not really a surprise. What we don't know is a lot about this virus. We don't know its incubation period. We don't really know the route of transmission.
And late today, the president signing that massive relief bill into law, the $2.2 trillion bill, the biggest ever. Checks now on the way for millions suddenly out of a job.
Congress established the Pandemic Response Accountability Committee, made up of 20 inspectors general. Their charge? To provide oversight of more than $2.4 trillion in taxpayer payments to Americans, loans to businesses, grants to healthcare providers, and financial lifelines to hard-hit industries.
Implementing the $5 trillion provided in the CARES Act, American Recovery Plan, and other emergency legislation requires the combined efforts of our elected leaders, government agencies at all levels, healthcare providers, and the business community. You're going to hear from some of these stakeholders today during this event. To start, it's my pleasure to introduce Senator Gary Peters of Michigan, Chair of the Senate Committee on Homeland Security and Governmental Affairs, who was instrumental in creation of the PRAC.
Hello, I'm Senator Gary Peters, Chairman of the Homeland Security and Government Affairs Committee. The coronavirus pandemic, which has taken the lives of more than 540,000 Americans, has also dealt serious financial blows. People across the country are still struggling to put food on the table, pay their bills, and make ends meet. I have worked with my colleagues to enact several bills providing communities with desperately needed relief. Without this critical assistance, the financial impact of this pandemic would have been even more devastating. However, we need robust oversight to make sure that federal relief dollars are spent appropriately and go to the families, small businesses, hospitals, and communities who need them the most. That is why I worked across the aisle with my House colleagues to ensure oversight of the federal coronavirus response and stimulus spending. These measures include the creation of the Pandemic Response Accountability Committee and a program of oversight at the Government Accountability Office, so we can root out fraud, waste, and abuse, and make sure we're meeting the needs of our communities. Over the past year, the PRAC and the Government Accountability Office have done tremendous work, despite significant challenges. The Government Accountability Office has issued bi-monthly reports on how we can improve the federal response. The PRAC has engaged the Inspector General community in a whole-of-government oversight effort. And thanks to these efforts, the American people know that we're working to ensure taxpayer dollars are being used responsibly, and they're helping us rebuild public trust in the federal government's pandemic response. Thank you.
Thank you, Senator Peters. We also reached out to Senator Rob Portman, ranking member on the Homeland Security and Governmental Affairs Committee. Senator Portman sent his regrets for this event and noted that oversight and the work of the PRAC could not be more important given the unprecedented amount of funds allocated for pandemic recovery. We thank Senator Portman for his support and look forward to working with him in our oversight efforts. Our first panel will take a high-level look at the successes and challenges with oversight of the federal government's investment in pandemic relief and recovery. Let me turn the program over to James Christian Blackwood, Executive Vice President of the Partnership for Public Service. James Christian.
Thank you for that introduction and greetings to all. I have the real honor of introducing two individuals that I've worked closely with. One helping with coordination of Inspector General offices across federal agencies, and the other helping promote accountability and build audit capacity across the country and world. I have a tremendous amount of respect for both. It is a privilege to introduce the Honorable Mr. Michael Horowitz, Chair of the Pandemic Response Accountability Committee and Inspector General at the Department of Justice, and the Honorable Mr. Gene Dodaro, Comptroller General of the United States and Head of the Government Accountability Office. Gentlemen, welcome.
Thank you very much, James Christian. Good day to everyone.
And with that, let's dive right in. As mentioned in the introduction, this is an unprecedented amount of money, more than $5 trillion, provided over a very short time frame and serving more than 330 million people and impacts an even greater number. For those joining us less familiar with audit and accountability organizations, can you give us a sense of what your organizations were charged to do and what goes into being able to provide oversight and accountability? What capabilities and resources does one need and bring to bear? Let's start with Mr. Horowitz.
Thank you, James Christian. So this is a unique challenge that we're facing as an Inspector General community. What the PRAC was created to do was a number of things. First of all, to bring together the Inspector General community for those IGs who have oversight responsibility of some of the pandemic-related funds. There are actually over 40 IGs whose agencies touch some of these pandemic funds. And so what we've done at the PRAC is work to coordinate among them and to ensure that we can help them with the tools they need the resources they need to get the job done. And importantly, as Senator Peters mentioned, to think about a whole of government approach. How do we look at this not only with respect to the individual programs affecting individual agencies, but where those issues cut across government agencies? And the major challenge for us is we're now looking at overseeing over $5 trillion in spending over the bills that have been passed over the preceding year, including most recently the American Rescue Plan. And so that amount of money, $5 trillion plus, is actually more than the entire fiscal year 2019 federal budget. And that's a significant challenge for us with the resources we have, but we are trying to look at it holistically, bring together the entire community, and make sure we're getting information out to the public, to the taxpayers, to understand where this money has gone, how it's been used, and ensure there's accountability for its use.
Great. Mr. Dodaro?
GAO was charged with making sure that we did real-time auditing to determine the effect on public health and the economy of all the assistance that had been provided and what impact it was having on both public sector and private sector institutions across the United States. To do this, we were required to provide monthly briefings to congressional committees, as well as bi-monthly reports to the public, as Senator Peter mentioned in his opening comments. So far, we've issued 5 reports. The 6th report for the 1-year marking point of the CARES Act will be issued next week. So far in those reports, we've made collectively over 70 recommendations for mid-course corrections to help deal with a number of public health issues, such as the vaccine distribution and communication strategy, having a national testing strategy to fill critical gaps in the supply chain, to also collect better information with regard to racial disparities and other information to have better data on complete and comprehensive and consistent testing results across the United States, as well as a number of transparency and accountability recommendations to provide better oversight over the federal funds that have been provided, particularly in the Paycheck Protection Program and the Economic Injury Disaster Loan Program. So to do this, we organized ourselves. Every GAO team, we have about 15 teams, has had a hand in this, looking at all facets of the government's response. We very effectively coordinated with the PRAC committee. Michael and I, Paul Martin and others talked right after the legislation was passed. We were working with the state and local audit communities as well. And so I think we've organized a very good structure to meet the expectations that were put on the accountability community to monitor and report and provide transparency and promote accountability over this vast amount of money that's provided to make sure that our public health goals are achieved and the healing of the economy and the efforts to provide help to individuals and businesses have the desired results.
Great. As you mentioned, your organizations have produced reports, testimony, and have been helping to ensure accountability nearly since the beginning. Can you share any initial findings and recommendations on how agencies are doing and how policymakers can better ensure accountability of these funds? Mr. Dodaro, please, sir, if we can start with you.
Yes, there's 4 evolving lessons that I think are critical, James Christian, to make sure that we can do a better job. I think the government agencies have done a very good job of getting the money out quickly. And that has been the preeminent concern. Unfortunately, there were some trade-offs made that didn't achieve the full transparency and accountability that was expected. So we've made some recommendations along those lines. So I think getting earlier transparency and accountability so you can balance speed with greater controls. I think there's been a lot more fraud than was hoped for in these programs, both in the some of the loan programs that SBA administers, the emergency loans, and then the unemployment insurance area, to name two. But other lessons learned are having clearer roles and responsibilities, not only among federal agencies, but among the federal government, state, and local sectors as well. A more clear, consistent communication strategy so the public understands these issues. There's been some areas and concerns about inconsistent guidance from the CDC on opening of schools, for example, and what kind of, who should be tested and when. And so we need to have more clear and consistent communication. And I think the agencies are responding and making improvements in these regards. And, there needs to be more effective data that's collected. As I mentioned earlier, our initial efforts were impeded because we didn't have clear and consistent testing data to where we should target the type of assistance that's needed. We know that there are disparate impacts that it's having on different segments of our population, but we don't have complete data on it. And now with the vaccinations underway, we have data on how many people are being vaccinated, but we don't have discrete data on what segments of our population are being vaccinated so that we know that we're vaccinating the most vulnerable parts of our population. So there's a lot of lessons learned that we're reporting on, and I think more to be determined in that area.
Great. Mr. Horwitz, can you share any initial findings and recommendations as well?
Certainly, and I echo much of what Jean just said. And as Jean mentioned earlier, we've been sharing those learnings with each other as we've gone along, including with our state and local counterparts in the accountability community. I do think there was this challenge, and has consistently been this challenge, of speed versus controls. You want to get the money out. Much of this money is designed to be essentially disaster relief. Get money out to the community to be able to move forward promptly and prevent, a year ago, for example, the economy from contracting as it was at the time. The challenge, of course, is you'd still want to have some controls in place. And for example, one of the things we have been concerned about was early on simply requiring self-certifications without much more in certain programs. Self-certification is certainly important. You want people to certify that what they're representing is in fact truthful, but simply to rely on whomever can come forward and is willing to certify truthfully or frankly untruthfully an application really isn't enough to do when you're dealing with programs like this. So we've seen that as an example. Data collection and data information, as Jean mentioned, has been critical. We've been concerned about the lack of data collection and lack of information for certain programs and certain agencies. Transparency has been a concern. We've issued a report about this last year about data gaps and transparency. The public needs to know where the money went, how it was spent, and whether it went to the right places. And so that others can come in, like the accountability community and economists and other analysts, down the road to see if the programs had the impact they had. We've been concerned that the speed that's gone on to get the money out, which is important, hasn't also included reporting back and collection back of information. So that's another area where we've focused our attention on.
Great. There's no doubt agencies are working hard. Your organizations are known for highlighting where there can be improvement. Both of you just noted several places. But your organizations can also be used to generate lessons learned, highlight bright spots, and curate best practices. Where are the agencies making great strides, and what can be done to build on those successes? Mr. Dodaro.
First, I'd say one of the greatest successes of this initiative was the rapid development of vaccines. The Operation Warp Speed and the government's support of those efforts, and we've issued several reports just on the vaccine development and manufacturing techniques. Now we need to get more production up, as has been very publicly reported. But historically, it would take 10 to 15 years to get vaccines developed. And what we find in that area is they followed traditional practices. They just did some things concurrently rather than sequentially to expedite it during this period of time. But that was a remarkable achievement that I think is in now being able to help us deal with this issue. Of course, there are variants now, and people are looking at the variants and things. But I think the whole development of the vaccines was a very remarkable achievement and very noted. The other major area, James Christian, is that the money got out fast. IRS moved to get the checks out to people. Now, there's some people they weren't able to find that don't normally file tax returns, and so some people got missed. But the vast majority of the money got out quickly in terms of the stimulus checks. The SBA got money out to small businesses. That's been a lifesaver for them, and a lot of support in that area. So the money got out, very quickly, and largely got to the people it was a desire to improve. But as Michael says, where our job is to focus on the oversight part, we'd like to see more discrimination and controls up front, which wouldn't have reduced the speed that much, but would have provided better accountability. But those are the two main successes, I think, James: the vaccines and the fact that aid got out quickly to individuals and businesses to help deal with the economic repercussions of this pandemic.
Great. Mr. Horwitz, feel free to add one of your successes, but I do have a specific question for you. It's the 21st century. There's an expectation for collaboration. The PRAC is composed of 22 inspectors general. How are you coordinating across organizations and ensuring no duplication of effort or overlap among inspectors general, as well as with GAO's work?
Great. Thanks, James Christian. That's a critical point. I'll just echo on the successes side what Jean mentioned. I'll add as well. Keep in mind, all of this has been done in the last year where most government agencies have been virtual. And so that's another part of this story that I think people need to keep in mind. Among many challenges that many agencies were having was the ability to do this while much of their workforce was remote. And I'll just add from the IG standpoint, that's true for the IG community. And in fact, the PRAC, which was created last March, exactly this time a year ago, we've operated entirely virtually for that past year in doing this work. And so I do think that's part of the successes here that are important to take away. In terms of how we've done coordinating, one of the first things we did was set up regular meetings among the entire community to ensure we were sharing information, to serve as a central point of contact for the PRAC, to be that. And so what we quickly reached an understanding with the IGs was that we would be that central point of contact. We would create committees within the PRAC of interest. So we have working groups, for example, looking at healthcare issues, looking at audit accountability issues, looking at investigative issues, looking at financial services issues, as well as a group. And one of the first things we did, as Jean mentioned, was reach out to Jean and GAO and our state and local counterparts to set up a group that meets regularly to make sure we're coordinated with each other, not just within the IG community, but with GAO, which has a critical mission and has a very talented staff that we've worked with repeatedly in the past, as well as our state and local counterparts. So we've tried to do all of that. In addition, what we're doing is at the PRAC, in addition to coming together to think about cross-cutting reviews and oversight projects that we can do, we're creating an analytics center. We're calling it the Pandemic Analytics Center of Excellence, the PACE, to help coordinate and support data analytics efforts for the IG community. Investigative support, audit support, trying to make sure that with all of these allegations that we're seeing of fraud, wrongdoing, analytics being used, data being used to help facilitate and focus our oversight efforts. And that's something that Congress has recently supported us with its funding and that we're looking to do more of.
Very good. And, another 21st century expectation is for innovation. Mr. Horowitz, you mentioned analytics. Mr. Dodaro, earlier you mentioned real-time auditing. Specific question for you, Mr. Dodaro, how is GAO using data, analytics, advanced technology, new methods to help with its oversight responsibility as it relates to the pandemic response?
Well, we've established a group within GAO to focus on these issues. And it's very important that we continue to evolve and develop in the area of analytics. More broadly, we've set up an innovation lab at GAO and our science, technology, and analytics team that are looking at issues beyond the pandemic. We're looking longer term issues. For example, now we're looking at how to develop a framework to audit algorithms for artificial intelligence, how to audit blockchain technology, and how to develop data. We've launched a project with OMB and Treasury under the Joint Financial Management Improvement Initiative to look at how you could use analytics to resolve improper payment problems in the federal government. Last year, there was the total estimate of government-wide improper payments was over $206 billion. This is a large and growing problem. It affects many programs and activities, but it won't be solved fully until we can prevent the payments from being made in the first place. So the Innovation Lab is working with our, with colleagues in the executive branch to try to deal with this issue. And so those are the ways we're trying to bring data analytics. I've also worked to set up a global working group of national audit offices across the world to focus on how to use big data, how to use it effectively. While we have asked for, in GAO's case, additional resources, given the debt and deficit situation of the federal government, we're not going to get large increases in a number of people in the accountability community. So we have to figure out how to use a huge amount of data that's growing exponentially every year or two to help make our work more efficient and effective, as Michael has talked about. But those are some of the initiatives at GAO, James, Christian.
Great. And we have several hundred participants joining us. So I've been monitoring the chat and I want to make sure I get to some of their questions as well. You both are responsible for monitoring and oversight of fraud and mismanagement. Can you give us a sense of how much fraud you've seen and how it compares to mismanagement?
Michael, you want to go first?
Certainly. So we've seen, and in working with partners across the IG community, as well as federal law enforcement and the U.S. attorneys community, federal prosecutors, a fair amount, unfortunately, of fraud. And many of it in the larger programs like the PPP, the Payroll Protection Act, Payroll Protection Program, the Unemployment Insurance Program, identity theft going along with that, as people have sought improperly some of these benefits. So we've seen a fair amount of it. And that's obviously unfortunate. Obviously, there are trillions of dollars here at issue, and that sadly brings about that kind of a fraud issue. We are, I will say, coordinating across the IGs. And so when you see some of those efforts underway by the community, you're seeing cases being brought jointly by the SBA IG, by the working with the tax IG, the FDIC IG, Treasury IG, those cross-cutting efforts. In terms of mismanagement, I think it's, as Gene said earlier, and we were talking about, I think there's a challenge and we need to be careful in thinking about how people made decisions on speed versus controls. And what we've tried to do in putting out reports, I know our reports, I know in GAO's reports, is not at this point look at whether this was mismanagement, gross mismanagement, strong management, but really put out what our findings are and how to improve things, recommendations on how to make them better. And the public can obviously make decisions about whether that was well managed or not, but we want to get out there the information to improve the programs as quickly as we can.
Yeah, I think, as Michael indicated, most of the fraud that we've seen has been in the emergency loan programs, both Paycheck Protection Program and the Economic Injury Disaster Loan Program, particularly where they were giving advances out to people in addition to loans. And so that was sort of cash in hand, and the unemployment insurance area. Now, in both of these areas, we've made recommendations, particularly on the SBA emergency loan programs. Now, while, as Michael indicated, there were self-certifications and there was things made to get the loans out quickly, we made some recommendations last June, which was right after most of the loans were already been made, that they need to have oversight plans in place to protect the integrity of the program, particularly because those loans have a component of either being forgiven or not, depending upon meeting a number of requirements. So they have to be managed effectively. And so I was disappointed of the slow implementation of our recommendations at SBA. I had a number of conversations with the administrator Carranza at that point in time, and I will be meeting with the new SBA administrator as soon as that can be arranged to talk about getting in place a number of controls. On the unemployment insurance area, you have a lot of antiquated systems in place and that have never been stress tested like they're testing now. Usually when we have unemployment problems, they affect an individual sector. In this case, it affected many sectors, and they were overwhelmed not only with the number of people applying for assistance, but the creation of new federal programs to reach gig workers, to reach part-time employees, people that don't normally participate in the program. So I think the states were very challenged, and that should provide an opportunity for us to look at lessons learned and how to transform the unemployment insurance delivery system in the future. And that's going to be the focus of GAO, not just program integrity, but transformation of that program going forward.
Great. Mr. Horowitz, are there any specific programs or aspects of the pandemic response that give you greater concern over others? And also, if you could talk about the relationship with agencies as you're working with them to help ensure accountability, how is that relationship?
So, I think, as Gene indicated, where we've seen the greatest issues and the greatest areas of concern as a community are in the PPP and the emergency loan programs over at SBA, the UI program, the unemployment insurance program at Labor. Those were the biggest dollar programs over the last year. Those are some of the programs that, SBA, they had to manage more money in the last year than I believe they had to manage in terms of programs in their prior 50 years. So real challenges there, real problems there. I agree with Gene. There are several areas where we as IGs and the PRAC would have liked to see a much more robust response to our recommendations and our concerns. One of them where we've continued to have concerns, and we've had very helpful and useful discussions recently with OMB about this, is data transparency, data collection, data availability. That's something that we had hoped would be addressed also early on. It wasn't. It needs to be. So that's something where we're pushing as well for increased emphasis, because I think for all of us in the IG community, we not only want transparency, we not only want the public to see where the money is going, but it's very difficult to have accountability if you don't know where the money's gone, how it's been spent, and what it's been used for, and be able to move forward and understand that in a significant way.
Great. This has been an excellent first panel. We're coming up right at time. I want to ask one last question. We'll start with you, Mr. Horowitz, and we'll end with you, Mr. Dodaro. I always want to believe the future is bright. Everyone does. Is there any encouragement you want to offer agency leaders, policymakers, and our country more broadly? Mr. Horowitz.
Great question, and a great way to end. So I do think that we are seeing significant engagement with leadership at OMB and the agencies. I think the public can feel comfortable knowing that they are hearing us and listening to us as IGs and as an oversight community. Certainly, we've had that recent experience. And I do think what we've seen here is from the programmatic information being reported out that the money largely did get to the places where it was intended to go. People should go to our website, pandemicoversight.gov. They can see there how the money has been spent. And what the public should also know is where the money was stolen, defrauded, misused, we in the oversight community are on top of it. They can take comfort in knowing that. We as IGs, GAO, state and local partners that we have, and we're using all our tools. We're going to go after fraudsters using criminal enforcement, civil enforcement. We're going to seek to suspend and debar wrongdoers, and we're going to look to recover money for the taxpayers. So we're watching to make sure that recommendations get implemented to improve delivery of services, and we're going to continue to go after and hold accountable those who stole or engaged in wrongdoing.
Excellent. Mr. Dodaro.
I think the public should take away from this experience that our country has some of the most brilliant scientists in the world and has some of the most compassionate and committed people and healthcare workers who have just worked tirelessly to provide care to a number of people above and beyond the call of duty consistently over a period of time. I think it also should take away the fact that we need to invest in our public health systems going forward. This has sort of laid bare the lack of investment in a number of areas in terms of the preparations that need to be made to deal with these types of national public health emergencies. And we're going to need to make sure that we continue to work on this and clarify roles and responsibilities among the levels of government for making those investments going forward, so we're in a better situation as well. I think the public should also take away that there are a lot of committed federal employees who worked hard under pandemic circumstances, as Michael mentioned, to deliver this needed assistance to Americans across the country. And the accountability community is working hard to make sure that that money goes to the right places. And if it doesn't, that people are held accountable for that. And that people are will be, held responsible through our law enforcement communities and others in order to pay for their misdeeds. And so unfortunately, in these national emergencies, the best of human nature comes out in American people in terms of the compassionate, the commitment, the care that we give, but it also brings out an element of people ready to exploit these circumstances and take advantage of them to the detriment of our society. And that's our job in the accountability community, is to minimize that, and where it is exploited, to hold people accountable.
Gentlemen, it really is a pleasure to moderate this first panel here. Thank you so much for being here. Congratulations to the PRAC as it celebrates its anniversary, and to GAO as it celebrates 100 years. Thank you both for your leadership, and thanks to both of your organizations for all of their efforts. I will now turn it back to Mr. Paul Martin for what promises to be an interesting and informative remainder of the program. Thank you.
Thanks.
Thank you, James Christian.
Thank you.
Great. Thank you, Gene, Michael, and James Christian for that excellent discussion to start us off. Let me pull back the curtain a bit and give Michael Horowitz, who had a reboot required at 8:59, 1 minute before he went live, the save of the day. It's a cool cookie. Now let's hear from two more members of Congress, U.S. Representatives Carolyn Maloney of New York and James Comer of Kentucky, the chair and ranking member, respectively, of the House Committee on Oversight and Reform.
Hi, I'm Congresswoman Carolyn Maloney, and as chair of the House Committee on Oversight and Reform, one of my most sacred duties is to provide the American people with transparency and accountability. This oversight is the foundation of the trust that beats at the very heart of our democracy, and it allowed my committee to recover almost $6 billion in mismanaged funds last Congress alone. Americans should know beyond all doubt that their hard-earned tax dollars are being spent on their intended purpose, and that perpetrators of waste, fraud, and abuse will be held accountable. In these unprecedented times, this mission has unprecedented urgency. That's why when Congress passed the CARES Act 1 year ago, I worked hard with Senator Gary Peters to include the provision creating the Pandemic Response Accountability Committee. We designed this oversight body to draw on the expertise of the inspectors general operating across federal agencies, representing the whole of government approach needed to fight the pandemic. Over the past year, the PRAC has undertaken the absolutely critical work of overseeing $3.3 trillion in pandemic relief funding approved by Congress to provide emergency lifelines to American families, businesses, hospitals, and state and local governments. Earlier this month, Congress and President Biden passed another historic relief package. The American Rescue Plan will mean the difference between recovery and recession, allowing millions of communities to rebuild and millions of struggling Americans to get back on their feet. To meet this mission, the legislation included an additional $40 million for the PRAC to continue and expand its work to safeguard the $1.9 trillion in the new relief. Among other things, this infusion will allow the PRAC to establish a new pandemic analytics center and to provide enhanced fraud investigation and auditing capabilities. In addition to this funding, Congress is working to support the PRAC by ensuring the effectiveness and integrity of inspectors general. A responsible administration doesn't politicize IGs, it prioritizes them. That means getting IGs nominated and appointed quickly, as well as responding to their requests with transparency and integrity. This could not be more important, which is why I'm working on comprehensive legislation to strengthen the independence and authority of our IGs. Democrats in Congress wrote the American Rescue Plan with the singular purpose of saving the lives and livelihoods of struggling Americans, to get vaccines in arms, return our children to school, help struggling families, and put jobless Americans back to work. I'm grateful to the PRAC for its work to ensure this purpose is properly fulfilled, because we don't have $1 or 1 second to waste. Thank you.
Chairman Horowitz, I appreciate your invitation to speak at the first anniversary of the CARES Act virtual event. During the coronavirus pandemic, Congress worked in a bipartisan manner to deliver targeted, timely, and temporary relief to protect our economy and American jobs. These bipartisan bills amounted to more than $4 trillion spent, a massive amount of taxpayer dollars that must be used efficiently and effectively. It's estimated at least $1 trillion remains unspent, with even more possibly available due to accounting and transparency failures in some states and local governments. On top of that already huge amount of money, Democrats recently pushed an additional $2 trillion out the door. This massive government spending highlights the need for a greater focus on transparency and accountability of these funds. It is the Oversight Committee's responsibility to identify and address government waste, fraud, and abuse. We have sought to do so by passing the Congressional Budget Justification Transparency Act. This bill requires agencies to make their budget justifications publicly available to shine a light on government spending. However, this is just a first step, and inspectors general often play a key role in identifying waste, fraud, and abuse because they are the boots on the ground, with subject matter experts reviewing spending in real time. Under the CARES Act, the Pandemic Response Accountability Committee, or PRAC, was created to coordinate across these inspectors general to use a whole government approach to prevent waste, fraud, and abuse. While it may have gotten off to a bit of a slow start, I'm pleased to see PRAC has begun to take the lead in coordinating data sharing and analytics across agencies' inspector general. I'm hopeful the PRAC and inspectors general will continue to expand on their use of new technologies to attack the problems of waste, fraud, and abuse within our government to protect American taxpayer dollars. Thank you again for having me join you today, and I look forward to continuing our work together to make the government more efficient, effective, and accountable to the American people.
Thank you, Representatives Maloney and Comer. We now pivot from our higher level discussion of pandemic relief oversight to focus on two issues at the center of the global response and recovery: healthcare and the economy. I'm pleased to introduce Dr. Ashish Jha, Dean of the School of Public Health and Professor of Health Services, Policy and Practice at Brown University, who will serve as discussion leader as we examine the state of healthcare during the pandemic. Dr. Jha?
So good morning, Mr. Martin. Thank you for hosting this, and a huge thanks to PRAC and the Partnership for Public Service for bringing us together here today. Obviously, this has been an unprecedented crisis in our nation, in the world. It's been an economic crisis, it's been a social crisis, but at the heart of it, it's a healthcare and public health crisis. And the bottom line is that the CARES Act has been fundamental and enormously important in helping our nation through this time period. As we now look forward to what I believe will be a much better year ahead with these wonderful vaccines that we have because of an unprecedented scientific collaboration, I think this opportunity to look back at the past year and to look at the CARES Act, think about the American Rescue Plan, how it builds on the CARES Act, and the implications of these things, both for the healthcare system and for the public health more generally, is really very, very important. And if we were to have this discussion, the two ideal people to help us really understand this are the two people we have here today. So they both are very distinguished, have long careers. I'm not going to spend too much time going through their bios. I just want to very quickly tell you who they are. First is Dr. Georges Benjamin. He is the president of the American Public Health Association. And second is Dr. Rochelle Walensky. She is the director of the Centers for Disease Control and Prevention. Two extraordinary public health leaders who've had, I would argue, among the most important roles over the last year in getting us through this. So the way we're going to do this is I'm going to ask each of them to speak for about 5 minutes. I'm going to ask Dr. Benjamin first to speak about the impact of the CARES Act on public health more broadly. And then I'm going to shift to Dr. Walensky, and I'm going to ask her to speak specifically about the CARES Act and its impact on the CDC, though obviously both of them can cover other ground as well as they wish. So let me start off with Georges, with you first. Talk about the impact of the CARES Act on the public health response in our country.
Okay, John, thank you very much for giving me a chance to talk about this. And also just want to thank the PRAC and the partnership as well for having us here today. The real challenge that people have is that most people didn't know public health existed, because our best work is always done when nothing happens. And we do a lot of the work that we do behind the scenes. They're the group of the federal, state, local partnership organizations, both governmental and non-governmental, who make sure the water is safe to drink, the air is safe to breathe, the food is safe to eat. And at the end of the day, when something bad like this pandemic happens, They're the disease hunters that identify it and do all the kinds of things that are necessary to contain it. And if we can completely get rid of it, great. If we can't, to control it. So public health, tragically, unlike the medical care side of our investment in our nation, and as you know, I practiced emergency medicine for a long time, so I know the medical care side of the house as well, has not been well invested in. And so the CARES Act has really gone a long way to begin to build that hole that we had, to make sure that we have the workforce that we need, the tools that we need, the skills and expertise to use the amazing science that has come out of this tragedy in terms of vaccines and other therapeutics. So our ability to use that is terribly dependent on our ability to have a functioning public health system which can integrate itself with the medical care side of our health system in our country. So we've looked very much for having additional resources to do this. Now, I got to tell you, as you know, spending money is not easy. And particularly when you have to go through government and you have to, put out job descriptions, and it takes a while to hire people. So there's an enormous ramp up time. And so we're really still beginning a lot of that ramp up, despite the fact that this is a year later. But I do see enormous progress based on the CARES funding. And so it's been very beneficial for the work that we do.
Great, thank you. Dr. Walensky, Rochelle.
Great, thank you, Dr. Jha. First, I'd like to thank the PRAC as well as the partnership for organizing this event. Dr. Benjamin and I did not compare notes before speaking, although I think you're going to hear some common themes. All too often, we don't think about public health until there's a catastrophe. And the cost of this pandemic has been staggering. And of course, it hasn't been just money and the economy, but it's most importantly been an astonishing loss of life. The pandemic has resulted in unprecedented appropriations, as has been noted, to address this unprecedented challenge. But before we talk about how the pandemic appropriations have made the COVID-19 response possible, we should acknowledge that this pandemic has been brought to the forefront of our long-standing and neglected public health infrastructure. We're at a turning point in public health, and hopefully this pandemic will turn out to be a transformational one for public health. CDC has been very fortunate to receive a significant amount of resources through supplemental funding bills through the COVID-19 pandemic. Specifically, CDC has received more than $30 billion in funding to support a range of COVID-19 activities, including things we were not doing as well before: surveillance, genomic sequencing, testing and contact tracing, COVID-19 vaccine distribution, access and coverage, and laboratory capacity expansion. Further, CDC has been awarded an additional $30 billion in funds to jurisdictions on the behalf of HHS to jurisdictional COVID-19 response efforts. And an additional $10 billion is being awarded shortly to support school testing efforts. So some examples of how the CDC has used these funds included enabling over 800,000 unique SARS-CoV-2 genomes to be analyzed since August 2020, helping to inform our understanding of COVID-19 variants. COVID-19 vaccine administration reports through CDC's immunization data lake. Increased capacity for states to report electronic lab data. We've gone from thousands of case reports per week for all conditions to millions of case reports for just COVID-19 alone. This represents an unprecedented scaling up for CDC and our public health partners. Expanded COVID-19 electronic case reporting capacity from healthcare facilities. Now 7,100 healthcare facilities in 47 states can send these reports electronically. This is helping to break down long-standing silos in data sharing. Expanded collection of data of race and ethnicity data, which will better inform the COVID-19 response in our public health interventions. Faster vital stats, reduce lag time on provisional health data from months down to weeks. And we know that states are doing critical and innovative things with the funding that they have received. We're hearing all about them every day. Although there have been so many challenges and so much loss in this past year, with these supplemental funds, we've actually been able to make really important, tangible progress in our efforts to combat COVID-19. So I think I'll leave it there for now, and I look forward to this conversation. I'm really excited to be here. Thank you.
Great. Well, thank you both. That was a really helpful framing. And so I want to dig down on one of the issues that Rochelle mentioned in passing, and I'm going to start with you, Georges, but then I'd like to come back to Rochelle, which is the issue around equity. So one of the things that we know is that this pandemic has certainly not affected all of us equally, that has disproportionately harmed certain communities, certain populations far more than others. Help us understand a little bit of why that has happened and how the funding through the CARES Act or other sorts of things have enabled us to both better understand what's going on and how, let's say, the American Rescue Plan might help us address some of the underlying issues that have created those inequities. So, Georges, if you don't mind, we'll start with you and then we'll go to Rochelle. Really thinking about the equity lens and how funding and support has both helped us better understand it, but also maybe allows us to begin to address it.
Well, let's think about how you get these disparities. So we have had disparities where particular communities of color have disproportionately been impacted by having more severe disease, more hospitalizations, and more deaths, disproportionately to non-Hispanic whites. And one of the reasons for that, of course, is a guy like me, I can go home and do these kinds of events from my desk at home. But if you're a bus driver, or if you work in a long-term care facility, you're a nursing home aide, you are a grocery store clerk, you don't get to do that. And for those occupations that may be disproportionately in some communities of color, they're more likely to be exposed to a disease in which you get from other people. And so we saw more people exposed. Couple that with the fact that those communities already have an underlying disparity or disproportionate amount of things like heart disease, lung disease, kidney disease, due to long-standing inequities in our society. Those folks we knew also, if you had those chronic diseases and you got infected, you are more likely to have a severe case. So some of the things the CARES funding did, for example, was it enhanced our ability to do testing. Because early on, we were testing initially only symptomatic folks. If you know, we had challenges getting enough tests out for people. We did work through that, but there were testing disparities. Also, where we put the testing sites, I think we were all excited, for example, when we saw drive-through testing. But those testing facilities, quite frankly, they weren't in the hood. And if you didn't feel well and you had to take a couple buses and stand in a long line, and of course, if you fundamentally didn't have a car, you weren't going to easily get access to testing. So the CARES Act has enhanced testing and made that more available. And then as we fast forward to getting more workers that could go into communities and engage people, more dollars to be able to adequately communicate effectively to people, because look, we had a lot of misinformation early on in communities, and we had to do brochures in multiple languages. We had to go out and bang on doors. We had to reach communities through community groups so that we could address some of this misinformation with trusted messengers so that people would want to get tested and want to show up for symptoms. And then finally, we had to work with employers to do things like encourage them to get paid sick leave, because one of the things we found out very early on, if you didn't have paid sick leave, you were much more likely to go to work, even if you didn't feel well. And you were also more skeptical about getting diagnosed, because if you got diagnosed, then you couldn't go to work. You couldn't go to work, then you didn't eat, and then that trickled down from that became a real problem.
Yeah, so really a whole set of systemic issues that obviously begin and way before public health, but with large public health implications and personal health implications. Rochelle, your thoughts on how the funding and support enabled CDC's work around equity in this disease, both last year before you came and became the director of the CDC, and then how you're thinking about it now as you look forward in the years ahead.
Right, thank you, Ashish. So you know, I go back and everything that Dr. Benjamin just said is, you know, rang true as I was taking care of patients last year, right? The patients who were coming in were not necessarily an equal distribution of what was out there in society. They were fundamentally of vulnerable populations and racial ethnic populations. The CDC came out last month with data of life expectancy in the US dropping 1 year for the first half of 2020, which is extraordinary in and of itself. It's terrible in and of itself. The life expectancy of African Americans dropped 2.7 years, and the life expectancy of Hispanics dropped 1.9 years. So I mean, even if you weren't at the bedside to see who was coming in, these are extraordinary statistics. We don't generally lose life expectancy in this country at all, ever. And so this is really pretty extraordinary. We've been thinking a lot about and working towards an equity response, both in the last year, but I'm certainly more familiar with what we've been doing with more recent funds. And I'm excited to sort of discuss actually numerous new initiatives that we're taking just even today. So we had $2.2 billion that we put forward for health disparities in communities of high risk, largely focused on testing, as Dr. Benjamin noted. Today, we launched a dialysis partners program. So we are working, there are 550,000 people in this country who are on dialysis, and people on dialysis, for example, have a mortality of 20 to 30% if they get COVID. People on dialysis are disproportionately African-American and Latino. So 34% are African-American, 19% are Latino. We've just partnered with these dialysis programs to do vaccination in these dialysis programs. They're trusted sites. People are coming 3 times a week. They know how to do vaccination because they've been doing it with influenza and hepatitis B throughout, and they're trusted. So those are the kinds of partnerships we're working toward. We have a $3 billion that's now been put forward to do vaccine equity and access in hard to reach communities. So we're giving these resources to states and to territories and large cities so that they can distribute them locally, so that they can distribute them to areas of high social vulnerability index, to areas of rural areas, so that they can do the outreach. And this is intended for door-to-door faith-based organization activities or for food bank activities, all those sorts of things that really reach the tentacles of the harder to reach populations. And then we're working towards, put forward $330 million towards community health workers. These are the trusted people in the community. When we say we want to meet people where they are, these are the people who meet people where they are. They're trusted, right? So we're working on training, technical assistance, scaling up the community health workers, because those are the people that really we believe will start getting people into care, getting vaccinated, getting tested when they're eligible, and then when they need the care, when they need care. My big vision would be that we have some sustenance of longitudinal funding so that we can keep these community workers engaged. Because one of the things I really do worry about is that we will have done sort of the one and done vaccine will be out of this pandemic. And yet we will have so much collateral damage in healthcare that we're going to need to, in health, that we're going to need to make up for hypertension, diabetes, all of these things. And it's going to be those trusted community workers that I think we need to call on again.
Great. I'm going to want to come back to that about how we build on what has been essentially a rescue plan, a short-term, short-term funding for a crisis, how we make sure that we build on long-term successes. But before we do, I want to ask both of you, and this time maybe I'll start with Rochelle first. One of the challenges over the last year has been around data and collecting data across states, collating them, putting it together. There's clearly been real progress on this, not the least of which is visible by the fact that the COVID tracking project folded up its shop because they said the CDC is now collecting the data that the country needs, which was always the goal. So can you talk a bit about, and I'll start with you, Rochelle, because obviously CDC is so central to this, but Georges, I'm going to shift to you afterwards to talk about kind of the broader public health community. where have we fallen down on the kind of on not having the data infrastructure we really needed as a country? What do you think we need to be doing, and what are you doing to repair that? And how do we make sure that as we come out of this pandemic, that we really have a world-class data infrastructure so that we're not caught so flat-footed in terms of data? Data isn't everything in a pandemic, of course, but it is the lifeblood of a response. If you don't know what's happening, it's very hard to respond. So can you talk a little bit about data from the CDC and then the public health perspective?
Yeah, there's so much to say here, and it's not, the data is going to come in so many different flavors. So obviously our public health labs and had challenges, and scaling up had challenges. We had insufficient frontline staffing. And then we had 50 states and 64 states and territories that had their own plans for how they were going to collect data and report data and demonstrate data on their websites. And then how they were going to feed it to us. So, as I started doing my tours early on in my virtual tours early on in my tenure here, I heard things from the state epidemiologists, we were getting lab tests by fax. And then what they were doing is, importantly, they wanted to make sure that their case counts were up to date. So they would input the positives, but not the negatives. So if you're talking about percent positivity, obviously we can't be doing that. I mean, there were it gets to the whole real infrastructure. There were real infrastructure challenges. Among the things, for example, for testing, we've had a real challenge in getting our race and ethnicity data up for testing, but the electronic case reporting, now we can link our testing data with things like Cerner and Epic, so it reports automatically, and we don't have providers asking everybody their race and ethnicity, and in fact, having some of them either not report or not ask. So there have been real data challenges. And so we need a data modernization plan, and we are working towards a massive data modernization initiative at the CDC, and really an interagency initiative that gets to, and quite honestly, I don't think we need a data modernization initiative for 2021. I think we need to understand what we need in 2040. What is the data that we're going to need to maintain a really good public health infrastructure and surveillance system and data in 2040, and make sure that we're striving towards that. And then finally, I'll just say something about genomic surveillance. There had been very little genomic surveillance happening. And that genomic surveillance, which we need the data on, it's not a plug and chug. You need informatics, you need data analysts, you need to not only do the analysis, but you need to have sophisticated people in order to analyze and report the analysis. So I'm really excited, because I think whatever it is that we're doing in COVID-19, which has been hard to get up to speed, but we're now sequencing about 4% of viruses we get every week. We will be able to use the wastewater surveillance. We will be able to use to identify other outbreaks in the future.
Great. So much to unpack there. And for those of you who don't know, genomic sequencing is basically sequencing the virus once it's been identified as somebody as infected, as a way to really identify variants that you've been hearing about. And it's such a central part of both understanding how infections are spreading, which variants are spreading, where, and identifying new variants before they become widespread. So that's a really important step in controlling this pandemic under your leadership, Rochelle. So thank you for that. George's, from your perspective, having really worked in states and understanding the issues at the state level, talk a little bit about the data challenges that we have faced as a country during this pandemic, how support funding so far has been helpful, but really what the vision for data for public health needs to look like as we move into the years ahead.
Yeah, let me just remind every parent who's had to buy a computer for their child going to school, and recognize that depending on what year of school they're in, that can be a 1 computer, 2 computer, 3 computer challenge. And then for those parents, tragically, who can't afford a computer, it's even a more significant challenge. The school may be able to offer it to you. Well, in public health, I'm going to take us back 20 years. I go back to 9/11, and prior to that, I was the Secretary of Health of the Maryland State Health Department, and we required all 24 of our local health departments to have 1 computer. that they could use for data analysis and statistics, et cetera. And the cost, of course, that line was hardwiring those computers in. They were very expensive. You know, computers cost $5,000, $10,000. They were clunky. We remember all those things. Well, then we had 9/11. Then we had the anthrax letters. And there was a bolus of money that came in. It was to try to modernize some of our systems, but it wasn't enough. Everybody didn't get it. You know, if you think about what's happened over those years, the fact that we still have health departments that are using pen and paper to write information down and fax machines to share them around the country tells us the level of disrepair that did not happen. And even the ones that were brought up to speed 20 years ago, the money didn't sustain itself. And so obsolescence kicked in. So if you think about putting together an army that you're trying to equip to go out and go to battle and to engage these terrible infectious diseases which are threatening to our health, and we don't give people the tools that they need to do it, that's what's happened. And despite, I gotta be honest, lots of yelling, screaming, sending letters to a range of elected officials, resource allocators, we would get little boluses of money that were disconnected to build systems that didn't talk to one another because they were designed for very narrow purposes. And so I think Dr. Walensky's idea of being very forward thinking and trying to think about what the world's going to look like, 20 years from now, and what are the systems we're going to need so that we can talk to one another, share information. And by the way, we have a unique responsibility to do so even more confidentially than anybody else. So we can do this. By the way, if anyone doesn't think we can do this, Amazon does it every day. UPS does it every day. FedEx does it every day. Most mom and pop stores do this every day. They all know all the stuff coming off their shelves every day. And yet we've never had the investment, at least on the public health side, to do this. And might want to add, and then we have to then connect that system effectively to the medical care side of the house so that we can share that information, again, appropriately, confidentially, and safely for patients' privacy.
It's great. So many important points there. I do want to say that I hope one of the silver linings out of this horrible pandemic might be that we finally retire the fax machine. Let's hope that happens. So the obituary on the fax machine has been written before and unfortunately prematurely. I want to shift a little bit to a question that has come in from the Q&A that I think is really important, which is the issue around public trust and misinformation and how we counter that. One of the challenges in this pandemic has been the sheer amount of misinformation that's been out there about the virus, about therapies that work for the virus. And now a lot of that misinformation is shifting towards vaccines. And, we have a superb healthcare, public health community that I think has done a generally good job, the FDA, NIH, CDC, but it hasn't been enough. It hasn't been enough. And that misinformation, I think, has been costly to us. So what are the lessons that we've learned of the last year around misinformation? And then how do we counter it and build up confidence in people so that we really can focus on the science and focus on fighting the virus and not on misinformation? And Rochelle, if you don't mind, since you've been such a phenomenal communicator throughout this whole pandemic, I'd love it if we could start with you, and then George, as you've also been, so no slight, but I'll go to you afterwards.
Yeah, first of all, I think you have to just communicate and say what you know and be willing to say what you don't. The thing is, and Tony Fauci says this often, if things were static and we weren't constantly learning, it would be kind of easy because then the information could be static. But we are constantly learning and we have to update. And sometimes we learn and we're surprised. I think one of the biggest surprises, if you date back to where we were in February, is that this was a virus that could be transmitted asymptomatically. It would be our public health Achilles heel. We didn't know that. And we didn't actually have a reason to suspect it. Its cousin SARS doesn't do that. And so we were surprised. We were caught, we were caught off guard on that piece of science, but we had to let people know, and we had to pivot when that science emerged. And so I really do think we have to communicate what we know, communicate what we don't, and communicate new science that comes forward. In terms of vaccine confidence and misinformation, sadly, I think there are going to always be people out there who want to convey the misinformation. And what we really do need to do is just combat that with getting to trusted people, getting our word out there. When I think about vaccine confidence, or sometimes people call it vaccine hesitancy, it's really interesting. I date back to my days doing HIV work, which were just 2 months ago, where when you told people a new HIV diagnosis, you never really knew what it meant to them. Were they worried about their children? Were they worried about their life? Were they worried about their job? Were they worried about their partner? What is it that they were worried about? And I think a lot about that in vaccine confidence. When you say to somebody, and when somebody says to you, I don't want the vaccine, is it because they don't want to take the day off of work? Because it's not convenient? Because they don't know anybody who's gotten it? Because they're worried about the side effects? Because they're worried about the science having moved too quickly when 100,000 people have been enrolled in these clinical trials? So we really have to tackle those issues, combating the misinformation that's out there, but really talking to people about what their concerns are. So what is it about the vaccine that you're not interested in? We had some data from early long-term care facilities that folks in the providers in long-term care facilities, the uptake wasn't as high on the vaccines as we would have hoped. I think the time is to go back and ask them again, because now we've vaccinated over 80 million people, right? Maybe they just didn't want to be first, and that's totally fair. So I think we really have to meet people where they are and understand what is it about it. And increasingly, people, I think, are more and more confident with the vaccine, which I'm really encouraged by.
That all makes a lot of sense. Georges, your thought about misinformation more broadly in this pandemic, vaccine confidence specifically, and what we all could be doing, both the federal agencies, state public health leaders, but just the broader scientific community.
Yeah, I think that just to lay the groundwork, I think Dr. Walensky pointed out very clearly the approach to this. But I think to add to that is that, most people aren't tracking science each and every day, but they have been doing this pandemic. They've been watching the conversations that we scientists have, and physicians and nurses and docs, and every day amongst ourselves. They've watched the debates we've had about, is this going to work? Is that going to work? How much is going to work? What is it going to cost? Who gets it? This has been one of the biggest scientific engagements of the population around the world in real time. And we've been able to do this, for better or for worse, 24 hours a day, 7 days a week, thanks to cable TV, and all the other measures, news conferences, et cetera. So with that in mind, we have to recognize that the public is not used to the fact that science is an evolutionary period of discovery. And I think one of the lessons for us is that we have to be clearer with people about what we know, what we don't know. And when we change our minds about something, because we've learned more, masks are the best example, right? Then we should explain why we're changing our mind. And people are really smart and they're thoughtful, but they have to give the information. And one of the things that we often do is just assume they know. For example, I think we made a poor assumption that people actually knew what a vaccine was. And I would argue we should take people all the way to the beginning and tell them what a vaccine is, tell them how it's made. The fact that we've been doing this kind of research, particularly with mRNA vaccines, for many, many years. And then we were able to put it together by doing the science the way we normally did it, but getting the bureaucracy out of the way was how we were able to do it so quickly. But we haven't, we're beginning to do that better. And I'm glad to see that's becoming an effort. And I also think that we need to listen more than talk about these kinds of things. Because I think, as Dr. Walensky pointed out, don't make an assumption why someone doesn't want to take the vaccine today. There are lots of reasons for that. And we're seeing more and more people, particularly, African-American concerns have turned around 180 degrees since they were last summer.
Yeah.
So people will change their minds.
Yeah, and often also I think we confuse issues of access and information for hesitancy when they're really different. One last just quick point on something both of you said, which I think is really important, and then I want to get forward looking, is science is a process, not a destination, right? And so the scientific process means you're updating information, you're learning new things. And in a novel virus, that's particularly true. We're going to learn new things. We're going to learn new things about this virus a year from now that we don't know today. And not only is that okay, that's a good thing. That's what we want. So, but that does pose some challenges on communication. Let me shift a little bit. We only about 7-8 minutes left, and I want to focus a bit on the future. So the CARES Act, both of you have done a really incredible job of laying out all the ways in which it has been helpful to us in getting through this crisis. We have the American Rescue Plan, which of course adds substantial resources into public health as well. I have two related questions. How do you see the kind of most important set of investments over the next 6 to 12 months in terms of continuing to move us as a nation through this health crisis? And then the second question, I'm just going to go ahead and ask it now, is how do we make sure that these investments have long-term payoffs? They don't just help us get through this crisis, which of course is fundamentally important, but that they end up having longer-term benefits for the health of the American people. And again, Rochelle, if you don't mind, I'm going to start with you, and then Georges, I'll go to you after that.
Great, thank you. It's such an important question. The next several months, we need to focus on getting this country vaccinated. As many people as we can reach. The vaccine, it's historic. We have 3 in under a year, and several that are coming up. So we have to focus on getting the country vaccinated. We know 65, for people over the age of 65, the mortality rate in January for them was 16 in 100,000. The mortality rate in March is less than 1 per 100,000. It's pretty extraordinary what this vaccine can do. We really do need to get the vaccine out there. I will say we're still at a death rate of about 750 to 1,000 a day. And if it's not the older people that are dying, it's now younger people who are dying. So we really do need to get more vaccine out there, and that's going to be a massive push. We need to continue with our genomic sequencing, because I know, Ashish, you have specifically said we're in a race, and we are in a race. We still had 59,000 new cases of COVID today, or as I should say yesterday. And we really, the more virus that's circulating, the more vulnerable we are to a variant that could emerge that could actually undercut all these efforts that we've had. I do think we need to have a global response, because whatever happens around the world is definitely going to reach the United States. We need to build the public health infrastructure that we've been talking about, the data infrastructure, all of this with an eye towards equity. And then we really need to make sure that it sticks, that whatever the one-time investment is now, and I know it's been extraordinary and we've needed it, we need to understand what the steady state looks like, because the steady state where we were in 2019 simply wasn't enough. We were not prepared. And while this epidemic was one that came around every 100 years, we have no guarantee that we're going to wait another 100 years for the next one. And in fact, it's very likely that we won't, given how much we've been, international travel, and how many infectious threats we've had just in the last decade between H1N1, Zika, Ebola, and now COVID-19. So we do need to make sure that all of these public health infrastructure, there is sustainable funds for them. And then maybe finally, I will just close and say, we will not improve public health in this country because some fancy new expensive drug is accessed by a handful of people. We will improve the health of this country if we can reach all those people that have been deprived of public health efforts, that have lost control of their blood pressure, lost control of their HIV, and we raise that health in this country. So I really do want to do all of this with an equity lens and make sure that all of these efforts we are putting forward now to reach these communities through community health workers can stick, and that we can do hypertension control efforts and salt reduction efforts and weight loss and diabetes control, and do all the things that we need to do to make sure that this country is a healthier place.
And before I go to George's, can I just ask you one last question on that? Because so much of the public health work that needs to be done is right at that intersection between traditional public health and healthcare. So how do you think the public health world, partners a little bit better with the healthcare systems? What else can we do to kind of build that engagement? I mean, some of it we talked about with data, but beyond data, are there other things that we can be doing to do a better job partnering with the healthcare system?
I think our healthcare system, this pandemic has created some of those partnerships. I was on a school summit yesterday where I heard from the Cleveland schools where they talked about their partnership with their Cleveland hospital system. Those partnerships happen by necessity through this pandemic. And we just have to make sure that they don't dissolve, because I think through the community health workers, through our public health, I know many people in our hospital where I was previously were sitting with the state health officers in the state. Those happened organically in this last year. We just need to make sure that they remain intact.
Fabulous, thank you. George, I think you're gonna end up getting the last word here. Talk about what are the kinds of investments you see that we need to make broadly in public health. Rochelle's really covered the waterfront on this, so it's going to be complicated, but to add. But and then how do we make it stick for the long run?
Yeah, so we ought to think of this as a three-part act. You know, the CARES Act was foundational. It stopped the bleeding. It plugged the holes up as best it could, and it gave us a chance for us to begin to revive our economy and get our hands around this terrible, terrible epidemic. The second thing is the American Rescue Plan now completes that effort. It solidifies the foundation, and it begins to give us a capacity to build as we go forward. The third act has got to be that we sit back and do some thoughtful thinking, utilizing some of the funding from the American Rescue Plan, and think about what the new investments need to be in a more structured approach to build a system that we can identify anytime any kind of new health threat enters the community, rapidly address it, and then build the system to mitigate it. And we've got to recognize that one of the big lessons we've learned is that this happens to happen across sectors, that health doesn't live in a bubble, and that all of our economy has to be part of the solution if we're going to have a healthy, thriving society. Because I agree with Dr. Walensky, the next one of these pandemics is just around the corner.
And I'm going to ask you the same question I asked Rochelle about, we spend as a country more than $3 trillion on the healthcare system. How do we build better partnerships between public health and the healthcare system so that some of this stuff can be sustained through those mechanisms as well? Any thoughts on that, Georges?
Yeah, the tragedy is we don't need a nation in the world that divides our system into public health and healthcare. And I think those days are over. We need to have a more robust public health and medicine initiative to move forward. And that means we need to start meeting more collaboratively together, building systems together, and stop looking at ourselves as segregated in terms of our response. We need to be looking from, whole of life expectancy, from birth, in fact, pre-birth to death, and build a system that enhances our health and well-being across that. And then again, as I mentioned earlier, with all the sectors of our economy involved as part of that process.
Great. Well, let me just say to those of you listening, I told you that we had two of the leading and arguably the two leading public health experts in our country today. And I think you now understand why I said that. Huge thanks to both Dr. Rochelle Walensky, Director of the CDC, and Dr. Georges Benjamin, President of the American Public Health Association. This has been an unprecedented, once-in-a-century crisis. But as Dr. Walensky said, I don't think we should assume that it will be another century before we have another one. The CARES Act was fundamental, and I think Dr. Benjamin captured it. It stopped the bleeding, and that was the first step. But we have a lot of work to do to make sure that we are much better prepared as a country, that we're focused on health and public health. So thank you to the PRAC, to the partnership, and let me turn it back over to Paul. Thank you very much.
Great. Thank you, Dr. Ja, Benjamin, and Walensky for sharing your insights on the state of healthcare 1 year into the pandemic. And on the advice of my new personal physician, Dr. Jha, I've unplugged my fax machine. Now on to the final topic of today's event, the economic impacts of pandemic spending and response. For this panel, I'm pleased to introduce our discussion leader, Dr. Wendy Edelberg, Director of the Hamilton Project and Senior Fellow in Economic Studies at the Brookings Institution. Dr. Edelberg?
Hello, thank you very much for introducing me, and I am thrilled to be here. I will be joined by Steve Ballmer, founder of usafacts.org, a nonpartisan data source on government spending and generally a treasure trove of fabulous information, and Doug Elmendorf, who is Dean of the Harvard Kennedy School. So welcome to you both.
Thank you very much.
Thank you, Wendy.
All right, so Steve, I want to start with you. So let's first set the stage. So we're going to be talking about the economic effects of the major legislation that Congress has enacted since March. So obviously the CARES Act, the Consolidated Appropriation Act, also known as the $900 billion of fiscal support that was passed at the end of December that nobody really knows what to call, and the American Rescue Plan recently enacted, $1.9 trillion. So these were really significant pieces of legislation. We'll be talking about how they affect the economy and coming all the way through to what lessons we may have learned about fiscal support in the next crisis. All right, so Steve, you had this amazing bird's eye view with usafacts.org. So here's my question. What has your vantage point of that really broad perspective that usafacts.org offers you? What has it told you about the role of government money in the economy over the last year?
Well, a couple things. Number one, I'm not an economist. I won't do any forecasting, and that is my strength in this discussion. We do prepare this website that tries to gather government numbers and put them in an understandable way. I love numbers. I have looked at the numbers. I will give you two high-level things. Number one, I have no idea how anybody in government is making any decision. The numbers are not really enough to guide action, and yet people just keep spending. We can't tell you, for example, who really did save money last year. There's no government numbers to tell us right now. Is it the most affluent people? Is that why our savings rates are up or down? I don't know. We're flying a little blind, in my opinion, at least for me, who used to run a very large company. I would never fly as blind as we are with trillions of dollars. It just makes no sense to me. The second thing I would say is, looking at it as a business person, a citizen, it's hard for me necessarily to comprehend how the level of spending really ties into the level of outcome. It may do that, and I'm sure we can find economists on both sides, but it makes me scratch my head. We were in a very crisis time, I get it, but given that I was scratching my head a little bit before the last 1.9 trilskis, so to speak, it makes me double scratch as we look at the ARP. Doesn't mean it's wrong. I'm not trying to say something's wrong or right, but it does make it hard to understand, so to speak, just by the numbers.
All right, so maybe Doug can answer your question. So Doug, I'd like to ask you, in fact, about the effectiveness of the different kinds of fiscal support we've seen. So we've seen fiscal support for workers and households facing urgent financial distress because of the recession. We've seen support for businesses through both fiscal and monetary policy. We've seen support for state and local governments, some of that directly tied to how state and local government agencies need to get the pandemic under control and distribute the vaccine. And then money for individuals that will help, among other things, temporarily mitigate long-standing financial inequality that we know households came into this crisis with. And indeed, we also know that these most financially vulnerable households have really felt the brunt of the recession. All right, so if you buy my rough categorization of these different categories of fiscal support, how do you think about the effectiveness of policy in each of those buckets?
Thank you, Wendy. It's good to be here with you and with Steve. Let me first agree with Steve that the government collects far too little data in real time. to reliably guide our economy. If we understood more about what was happening from day to day, week to week, month to month, and not just in the aggregate data about the economy as a whole, but at the level of individual households, we'd be in much better shape. And we should, as a government, collect more of that data. It's also true, as Steve says, that the government has unleashed a tremendous amount of monetary and fiscal firepower without knowing exactly how that firepower is going to land. And that is an unfortunate feature of economic policymaking. Economics is a pretty difficult subject. I say that as an economist who spent my career trying to understand better how policy matters. And economists just don't know, in part because the economy is changing all the time. And what may have worked a certain way yesterday might not work that way today. All that said, I think that the legislation we've seen over the past year has been pretty well directed, albeit in very large magnitude. For households who have suffered in particular during this time, money given to them has provided both relief to their personal circumstances and also support to overall economic activity by giving people who really need money to spend the money, which they have then gone ahead and mostly spent. So that the money directed at struggling households, I think, serves both as a relief and a stimulus. Support for businesses that you mentioned, partly through fiscal policy, partly through actions by the Federal Reserve, as you noted. I think it's harder to know how well that has worked. We don't have a lot of experience trying to support businesses during a period of a shutdown. Past recessions in this country over the last 3/4 of a century have mostly been around collapses of business or household spending, for which a sort of fiscal stimulus, we sort of know roughly how that works. When you have a shutdown, how you support businesses during that period, much less well understood. I think it's good that fiscal policy has tried to help businesses, but we don't really know, I think, how much difference that has made. For state and local governments, the third of your buckets, for those governments, their financial problems have turned out to be much less severe than many people worried. When I testified to House committee last summer, I pushed for more support for state and local governments. I think it's turned out that because of the way the economy income flows have come in, those governments are not as badly hurt as we thought they would be, but they were still hurt. Some support was certainly important. And my own guess is that some of the additional money that's been provided now, beyond the shortfall they're experiencing, will go to support other sorts of state and local government activity. How one feels about that is really a matter of whether one thinks that state and local governments should be doing more of the sort of things they do or less. My own view is that these governments have been really pinned down by rising healthcare costs, excuse me, over the last decade, and that providing some financial breathing room is constructive. But people who have a different view about state and local government activities might lean the other way. For households that have not particularly struggled, but are now getting significant checks, I think that's not necessary as a matter of short-term relief, because it's not targeted at those that have lost jobs or businesses during the pandemic. It's not needed as a matter of overall stimulus to the economy, because in fact, the other money being spent is probably enough to provide the right stimulus for the economy. I think the two main reasons why these extra checks are going out. One is a concern by the part of policymakers that the risks of doing too much and too little are asymmetric. We may want to come back and talk more about that. So that's a sort of a technical economic reason, if you will. I think the other reason is the view on the part of the Democrats in the administration and now in control of Congress that it'd be good for the government to do more for lower middle income households. And in particular, the view that the 2017 tax cut was particularly beneficial for households at the top of the income distribution, and that it's appropriate now from a Democratic perspective to provide more support for those throughout much of the rest of the income distribution. But that is an argument about long-term support for them. It's not an argument about immediate relief or the need to really spur the economy.
I want to highlight a couple things, but one thing that really makes no sense to me. It really makes no sense to me to give people money not less fortunate families that need money, but to give business or government one-time money. I would never, as a businessman, give somebody, okay, every year we're going to let you spend $100, but we're going to give you $300 special now. There's no earthly way that money is not going to be spent. And particularly, you've got to not only spend it, but you got to spend it now, quickly. That kind of thinking in anybody who runs any kind of operation, not just business, will cause bad behavior. It'll cause you to do some crazy one-time thing. So all of this money that's being approved, a lot of it on a one-time basis, I think is going to incent all kinds of bad behavior. We're not going to help the families that Doug just talked about. Not really, not if the benefits disappear in a year or two. Now, somebody might say, okay, they're just a prelude to what is to come. But then I think it's particularly bad behavior. It's bad behavior to allocate a bunch of money and then hope you can come back and give it to families again. I mean, I just don't begin to understand. I think government does this over and over again. This is not a D or R. I'm a very nonpartisan guy. Government overshocks and responds both ways on the economy. And thank God it manages to sort of always get back to its regular steady pace of growth. But getting this kind of one-time anomaly, take the state and local government money. State and local government taxes were only down $10 billion, 1% year over year, 1%. What I'm not remembering right off the top of my head, but what are they getting? Hundreds of billions of dollars to spend? What are you going to do with that? You're supposed to spend it quickly? It's not like you can go build new roads. I mean, in our own state, I'll just tell you, the local newspaper's already advocating against new tax revenue because we've gotten all this great windfall money from the government, which actually would be okay even under the current interpretation of laws to not do new taxes, whether we can remove taxes or not. I think the one-time nature really people need to think about, because the one-time nature, I don't think affects long-term behaviors. I do think it's important to give money to people who need it. I'll give you another example, this business loan thing. I think it could have made good sense, but it was just a trade-off between unemployment insurance and PPP for all intent and purposes. I own businesses that remain shuttered, i.e. I run a concert business and a sports business, and everything remains shuttered. Sure, we either could put people on unemployment or we could take PPP money. In my own case, I've been so fortunate, we just decided to do neither and keep people employed, which was good, but that's because of my good fortune. And you say, okay, which is the best way to do this? I don't think we were stimulating business. We were just putting people in a decision between unemployment insurance and PPP. So looking at these numbers, and then, what did we take on this year? An additional, I don't know, off the top of my head, I want to say an additional $3 trillion of debt. Business people, citizens, we all have a hard time. I know economists have an easier time understanding why this is okay in the long run. It for me is a head scratcher. And again, I'm not saying the programs are wrong, but particularly as we're invited by the Inspector General community that's supposed to be asking questions about whether there was waste or abuse in these programs. You just look at these numbers. These are the kinds of questions I'd ask. Sorry, big job. And I do agree with Doug on much of what he said. I just wanted to stir the pot a little bit.
So let's definitely come back to that issue of debt in a moment. But first, Steve, I want to press you. So then, all right. So you've highlighted where you think the shortfalls were in the fiscal support that was rolled out. Are there missed opportunities that you see? I mean, I guess it's a version of the question, if you could wave a magic wand, what would you have done instead?
I would have, I think, again, I'm not this expert, but what I would have done, I would have prioritized unemployment above everything else, clearly above everything else. You have an unfortunate family, let's make sure we support that unfortunate family. Job one, that clear to me, I would have funded all of that. I'm not sure I would have done any of the one-time stimulus. Again, unless it's well targeted, Doug already talked about this well, I would have done maybe more unemployment, not done the stimulus. The businesses, I don't know quite how that would have done. To me, the goal there would be to keep businesses in business, not to just keep people employed. If you want to pay people so they can live, do it through unemployment insurance. And we do have businesses shuttering. Should we have been putting money up whose sole purpose, for example, was to keep small restaurants in business? I don't know, but I don't think the money was well targeted to that purpose. Do we keep small business infrastructure alive? Call those the unfortunate businesses, the ones that are going to go broke. Do we take care of the unfortunate people? I would have prioritized those two areas. State and local government needs to break even for a reason. And I like that. And the federal government just throwing more money at the problem doesn't seem right to me. Many government workers have job protection, although there was actually a significant job loss. I want to see about 1 million jobs, something like that in state and local government. So that is worth that, and that's with stimulus money. But I would have prioritized failing businesses, failing families, if you will, financially. And a lot of the other stuff, the one other thing with hindsight, and I'll ask Doug, he's the economist, that sort of troubles me is, of course, tax revenue didn't go down very much. It was after the fact, I said, of course. Affluent people pay such a high percentage of all taxes. And affluent people, I'll tell you, had a good year. Didn't lose their jobs. Stock market is solid. And so in a sense, you have to say, of course, tax revenue was not down as much as at least I might have catastrophized at the beginning of the year. Doug wants to jump in.
Well, no, so I think you're right, Steve, as it's turned out. I think it wasn't so obvious to start with. So take us back to March, April a year ago. One thing was the stock market was actually plummeting. As somebody who's the dean of a school was fortunate to have a significant endowment and therefore somewhat dependent on endowment payouts. This is a subject that I follow with some care these days. And there was a very sharp decline, right, in the huge declines in the stock market. And so, and also at that point, again, we've never seen a recession induced by a pandemic in the last century of observation. And so there was huge uncertainty. And but it's good that in the end, state and local governments did not get as badly hit. But I would just say they are under long-term financial stress. The cost of healthcare in this country, as we all know, is rising rapidly. That's not just a feature of government healthcare programs. It's true in private sector-led healthcare programs as well. And so that rising cost of healthcare is hitting the budgets of a lot of parts of our society, right? It's hitting the federal government budget, part of why federal spending is rising on some of these big benefit programs. It's hitting businesses and family budgets, and it's hitting state government budgets. And so there's a set of things that state governments were doing a decade ago or a dozen years ago before the financial crisis that they've not been able to get back into because the recovery from that crisis and then the burden of these healthcare spending has crowded out other things. Now, you're right, Steve, I wouldn't have done this on a one-time basis.
They won't be able to do those things anyway. Giving state and local governments money for their healthcare problem, but only giving it to them one time.
So again, you
can't give the states one-time money and say, okay, go spend for the next decade. It doesn't work.
Well, but remember here, so first of all, state governments, in addition to the money they have lost, and there is some they've lost, they've had to spend a lot on vaccinations, on public health measures. Part of what's been squeezed out in state governments over the last decade is public health workforces. We'd have had fewer deaths in this country if state governments had maintained robust public health infrastructure over the last decade. And so they spend a bunch of money on public health now. So you got to think about both the extra required spending as well as the lost revenue. But also some of them had pulled money out of their rainy day funds. State government accounting is a complicated business. And but what I would do, Steve, and I think what you would do in a business, if you have a windfall, is that a temporary windfall, is that you invested in something, right? You don't use it to establish some ongoing commitment for which you have no money to pay next year or the year after, but you might invest it now. I don't know, to be honest, all the restrictions on the state and local government pieces of all this legislation. And this is part of what the PRAC, I think, is about, is trying to make sure that those restrictions are actually followed. But my hunch of this is that state governments will find that the smart state governments will find ways to make investments that set them up in a better position for the long run. They don't just throw kind of a party with the money and turn up tomorrow. But I also think, Steve, you're on an important point, which is that clearly the Democratic intention is to renew some of these programs in the future. And that's part of what we're going to see in, I think, legislation over the course of this year is an attempt to make more permanent some things. I think not large grants to state and local governments, but some other features of these plans. The leaders in the House and Senate and the administration will try to make permanent.
Well, look, our legislative process will play that out. Certainly, there's some things I hope do happen. As somebody who, in our philanthropy, we focus in on kids and families who basically have no shot at the American dream. With that said, just as a matter of common sense, if you take on the long-term challenge with the long-term challenge, otherwise you just get these bubbles, and every little bubble that the government causes leads to another pop of the bubble someplace down the road. That would be my concern, is the money won't get approved for long-term, and then all of a sudden now we leave people up high and dry on an island expecting to get more or having something taken away. And that's not a shot at the D's or the R's. It's just a call to say, hey, look, what's short is short, what's long is long, and let's match the two things up and have democracy, if you will, process over each of them separately. Otherwise, the numbers make no sense.
So we've spent a fair bit of time talking about the shortfalls in the fiscal support and how it could have been better. Doug, where do you see the biggest successes?
Well, I think the first success was quick action last spring. And economists have long noted and taught that fiscal responses can come slowly because of the workings of the democratic process. And I and others have done work about how to build stronger automatic stabilizers into our tax system and our spending programs to overcome the fact that it can be hard for the machinery of the administration and Congress to work sometimes. So the striking success was quick action last spring in force with significant amounts of money on the table, because of course that was the mistake that was made a dozen years ago, was insufficient fiscal support. One of the largest errors in macroeconomic policy in my career is actually the failure a dozen years ago to continue providing fiscal support into an economy that needed it. So I think the quick reaction was important. That was undone a bit by a failure to extend unemployment insurance benefits and provide further support last summer and last fall, when essentially all economists, both sides of the aisle, were clamoring for some action. I think it's important that they came back in December and again now with substantial support, although again, I wouldn't have done it quite in the magnitude that it was done or in quite the way it was done. I still think there's a huge success in using a lot of fiscal firepower. What we saw before the pandemic was how important a hot economy is. An economy in which there's a lot of demand for workers, puts people to work who are unemployed, draws people into the labor force, and then boosts the wages of workers, especially workers who have not done very well for the last few decades, workers in groups that face systemic discrimination in labor markets. And so there's a huge advantage to having a really robust economy. And that's part of why I think the risks are asymmetric and why you would want to do more stimulus than you would estimate that you would need, because it's better to err with an economy that's too strong than an economy that's too weak.
All right, so Steve, Doug's brought us into the future. So where do you see the economy headed? What sectors do you think will thrive? I mean, do you see 18,000 fans flocking to sports stadiums again or in the near future? And what do you think the future of work will look like? When you look into the future, what do you see?
Well, I'll say a few things. Number one, will these vaccines really work? I have no reason to believe that they won't, and they won't for the long term, but it's a fork in the road assumption. We will have some sort of second or next wave of pandemic associated with this. That's a branch I will not comment on. I'm going to assume we don't take that branch. If that branch occurs, We got a lot of problems, and you know, whether we gave enough stimulus or not, we're going to have a whole another set of stuff we have to target. If no pandemic return, I think we will get a return in our businesses, our live event businesses, over the course of about 12 months. I think we will start putting people into, or already there are sports teams that are allowing people into buildings. Do I think we'll have basketball stadiums filled with 18, 19,000 people by the start of next season? For sure. By the end of this season, I think it depends what jurisdiction you're in. My guess is not likely in California where our basketball team plays, but you know, I see that kind of a comeback, and I'm excited about it. That's number one. Number two, I am very excited about the economic possibilities that remote work will now open up. I don't know what'll happen, but I see the possibility for more productivity, particularly if people can balance hybrid. I see the possibility for less damage to the environment by less commuting. I see the advantage of perhaps some improvement in the overall housing prices, because there will be people who can work farther away or can work in places where there are lower cost housing stock, which essentially benefits everybody, even if it's just more affluent people leaving first, white collar jobs, people who can work remotely. So I see a lot of potential advantages having been derived from this new way of working that we get. I also, you know, I'm not an economist. I take a look at this and say, I think people will pop back. I think our economy, if you look at sort of growth in productivity, that is, we take out inflation growth and we take out population growth, our economy sort of trundles nicely uphill. It's a little bit slower in its slope now than it was, you know, if you go back 30 or 40 years, but we trundle up. And then the questions we'll be making, frankly, will have more to do with immigration in terms of economic growth than almost anything else, because in a sense, economic growth is immigration times productivity. I'm a big believer in innovation. Innovation will drive productivity growth. It has. I don't know. Let me stop there, Wendy. I'm rambling slightly.
No. But I do want to ask you one follow-up question. So you talked about how you know, an increased prevalence of remote work would create a lot of winners, and I even want to let's broaden that and just think about how all the automation that we have learned to adopt over the past year. For sure, there will be a lot of winners. Do you see only winners? Or do you think there will be both winners and losers from those developments?
I think there will be transformation. I think that is what happens in our world. I'm a big believer, if you look back, somehow all of the things that caused dislocation and also caused opportunity, and somehow net, we seem to be able to create more jobs going forward at all times. So yes, will there be a permanent impact to the retail business because people have learned to do more things online? I think the answer to that is yes. Now you're trading one kind of set of jobs for another. There will be people who are harmed. There'll be a desire to help them through that process, which I totally understand, but it will move in a new position. Commercial real estate. Again, I'm not a prognosticator. I'm not an investor, but if you're going to have fewer people working in offices, there's probably going to be less demand for commercial real estate. So if people have been building buildings and they're not full, I suspect that there will be some downside to that. Construction, are we going to see more new construction or not? I'm in the process of trying to build a new arena for our Clipper basketball team. We're dying to see right now what's going to really happen. What's going to happen with the price of labor? What's going to happen with steel prices? What's going to happen with concrete prices? We'll see. It'll tell us what the health of the world is, not only planning for the future, but also in terms of the pivot, in terms of what needs to be built. So will there be things that get dislocated? Absolutely. Some things will get dislocated. The question is net, Do we benefit, and can society help the people who are dislocated get through that with as little hardship as possible?
So Doug, Steve mentioned concrete prices, concrete prices of concrete. I am looking forward to seeing what happens to airfares. I think airfare inflation is just going to be staggering. So let's think, what does this economy look like as it booms over the next, once the taking is given that the vaccine is successfully distributed and the pandemic is behind us. Are you worried about that overheating? Is it? You talked a little bit about the asymmetric risks, but just specifically focusing on what are the risks of overheating?
Thank you. I was afraid you were going to ask me for my prediction of prices of concrete. I cannot help you on that. I wish you the best, Steve. I think, let me quickly pick up on two of the points that Steve made, and then I'll try to address the overheating more directly. I think first, super interesting question, whether people now, in the end, want to work at a greater distance. I do see tremendous opportunities, as Steve says, in this forced experiment of working remotely. And I will say in my own experience, it has worked surprisingly well. If you'd asked me a year ago how we would conduct Harvard Kennedy School without being able to be in person, I would have said that we would limp along and barely get a few things done. And in fact, we've taught all of our class sessions, we continue to do research, we reach out into the world. And so I think for a lot of people who've been lucky, like I am, to have a desk job where I can sit at my computer in my own study, this has opened new possibilities. We have to remember that the background for this before the pandemic was a huge clustering of economic activity in a fairly small number of places in the country, despite the unbelievable housing prices in Silicon Valley, in the Seattle area, and the Northeast Corridor, and so on. Businesses and people were crowding into those areas for the most part, because there seems to be some pretty big advantage in being around other people, working in your line of work, running into them, talking with them. And so we had this, I think, mostly successful experiment for this particular set of jobs, but that runs against the trend before that, which was actually for people to really be close together despite the complications. So I don't think we know how these forces are going to balance out in the future, and I think it'll be really interesting to see. The second thing I want to pick up from Steve's comments was the point about dislocation that you asked about, Wendy. And I think Steve is right that our economy over time has raised standards of living by dynamism. But it is also true that the dislocations have been terrible. And as we've seen over the last couple of decades, some from trade, particularly new exports from China, but more importantly, from technological change, certain sorts of jobs in certain places have been just completely demolished. And the costs of that are huge, in part because they tend to be concentrated. It's not some same percentage of jobs everywhere, where you might say, well, there are a lot of other jobs people can go into and people who lose jobs can be supported and so on. It's tended to be disproportionately some places that have had a real hollowing out, and then not just of the economic base, but then of the social conditions. So we need to get much better as a country in providing transitional assistance and retraining so people can keep their families together and can find work that is meaningful to them and productive for society. And we've really failed as a country to provide that sort of support. And it's incumbent upon us, I think, if we want to have the dynamic economy we want to have, that we pay more attention in a constructive way to those people who are left behind. And I think if we don't pay attention to them, then as both a moral matter and a practical matter, it's very hard to continue to push for the dynamism. Now, about overheating, there's a risk from the size of the fiscal packages over the last year that there will be so much demand for goods and services that prices will rise, and that the increase in prices will then persuade people and businesses that prices will keep rising, so they need to build that into their expectations and their own wage demands and price setting and so on. That's a sort of classic inflationary spiral we have not seen in this country in almost 50 years. And so on one hand, that is a risk. And people with longer memories, like mine, and people with longer memories than mine say, well, these things can get out of hand. On the other hand, we have now seen decades of anchored inflation expectations, which means that prices may jump up for a while in some sector, but people don't expect that to continue. And because they don't expect that to continue, they don't build that in. And my own view is, I think, very similar to what I take to be the view of the Federal Reserve System at this point, which is that there isn't very much risk of this sort of inflationary spiral. And if it started, then it can be tackled by the Federal Reserve raising interest rates and slowing some of the excess speed of the economy. So I think the right thing to do is to proceed with strong support for the economy, recognizing that things do get too hot, then the Fed has the tools to slow that down. But one should not dismiss other risks. And I think part of what is important for the Federal Reserve and for fiscal policymakers is to be attentive not just to the most likely outcome, but to the distribution of outcomes and make sure they have something in mind to do if things deviate from the forecasts.
So just backtracking one moment to automation and which workers are most subject to losing their jobs as a result of automation. I just want to give an advertisement for a piece that's on the Hamilton Project's website showing which jobs are most at risk of being automated. And as it turns out, those jobs are disproportionately held by people of color. So just an advertisement for that. Steve, I wanted to turn to the fiscal trajectory, but Steve, if you wanted to jump in.
I actually had one question for Doug, more than I guess you would say a comment. I sit in my seat and I say the economy, there is inflation. The inflation is in asset values. They seem very inflated to me. Multiples in the stock market, for example, seem very inflated. It seems to me that you can't actually think of asset values and wealth as differently maybe as we do from prices, because at some point there'll be pension funds that are invested in what I might call an inflation-fueled stock market, which then will be impacted by declines. And I get why we're trying to stimulate the economy, but I worry that we're just fomenting another bubble. And I'm curious how you would respond to that.
So I'll thank you, Steve. I'll answer that. And Wendy, I'll try to answer in a way that takes us to your next topic. So Steve, see if I can pull this off together. But I think they are connected. So Steve, you're right, of course, that price earnings ratios, other sort of measures of asset values are quite high by historical standards. And I think the immediate reason for that is that interest rates are quite low by historical standards. And so the 10-year Treasury note rate is up a percentage point over the last 6 months, quite a dramatic increase. But even at this increased point, it is lower than it's been almost any point in my lifetime. So more than half a century. And so with interest rates so low, which is to say the returns that you might earn by holding interest-bearing assets so low, then it's natural that the price earnings ratios would be high, which is to say that you'll buy a stock even if the dividend yield, say, is low because the alternative is also low. And so I think the fundamental question about the sustainability of current asset values is the sustainability of low interest rates. And then we come to the question of whether interest rates are low because the Federal Reserve has lost its head and is just sort of pumping liquidity into the system, or whether interest rates are low for some more fundamental reason. And so I should confess here that when I was director of the Congressional Budget Office and Wendy led the macroeconomic analysis division, we did a deep dive. This was now 6 or 7 years ago, Wendy, I think, into low interest rates. This is a point at which economists were beginning to analyze this really striking decline in interest rates, which continued not just from the peaks of the 70s and late 70s and early 80s, which was definitely an inflation-fueled rise in interest rates. So when inflation came down, rates came down. But even in the last, say, 1990, up to the financial crisis, when inflation was pretty low the whole time, interest rates continued to decline on government asset and U.S. government securities, but lots of other securities, other governments' securities in many cases, private bonds in this country. And so the decline in interest rates seems to have had a number of causes about economic changes in the pace of productivity improvements, changes in saving behavior and the distribution of income, international capital flows, a whole set of factors that combined demographic changes, thank you, to push interest rates down. And the best guess that we made at CBO at that time, when I was there, was that interest rates would stay lower than they'd been before, but would largely bounce back up. And in fact, now a few rounds since I've left CBO, and many other forecasters have continued to mark down the projection for interest rates, still expecting that eventually they'll come back more toward a longer term average, and federal debt may play a role there, but that they'll stay lower than they've been for a long time to come. And I don't think that's not a matter of the Federal Reserve. This was in place before the great financial crisis of a dozen years ago. And it really is a changing, now in the short term, the Federal Reserve can either fight that or live with it. It's lived with it because the economy's needed the support. But I don't think it's manufactured by the Fed. Now, could it change in the future? Yes, these factors are not God-given. They're matters of economics, and we're not good at forecasting as a profession. But in the short term, there's actually every reason to think that the rates will stay fairly low, not necessarily where they are now. That's not my forecast for like next month, but if you look over the longer span of history, they're likely to stay a lot lower than they've been. And that means that asset valuations can stay higher than they've been.
All right, so we have a few more minutes. I definitely want to talk about the fiscal trajectory, and I'm guessing you both do as well. So coming into the crisis, debt held by the public was about 80% of GDP and projected by CBO to rise to almost 100% over the next decade. So now using CBO's projections of debt, given recent legislation, and my efforts to graft on top of that what the ARP, the American Rescue Plan, would do to debt, my guess is that that puts us at debt to GDP at around 100% now. That's actually not much of a guess. That's actually CBO's data. But then rising to about 110% over the next decade. So on the one hand, those numbers are obviously a lot higher than what CBO previously projected, but the contour's flatter. And largely because of this issue that Doug was just talking about of interest rates, that CBO projects that interest rates, while they're expected to rise, will remain flatter than they thought before. So, all right, so that's my background on where we are on the fiscal trajectory. Steve, does that keep you up at night? Does that worry you?
Yeah, very much so. Very much so. Let me say, I think for my journey, there are three places you can get to. One, I came into my business life thinking you shouldn't owe people money, and if you have to borrow it, pay it back quickly. I think a lot of Americans probably start right there. My wife does, as an example. Then I get into business and I say, oh, you can borrow this stuff called money and you can owe it for the rest of your existence. It's okay. You put debt in as part of capital structure and you pay interest on it. You assume you can refinance it over and over again, but really you never have to pay it back. But you got to be able to pay for the service on the debt. Okay, I get that. Number three is, oh my God, we can keep borrowing more and more and more. And oh, by the way, we can help keep the price of our debt down because it turns out that this debt owed to the public thing, that's not meaningful anymore, I don't think, unless I'm confused. When the Federal Reserve becomes one of the buyers, then you tell me whether that's really, you tell me what the real buckets are. I think there's really three buckets that need to be talked about. Debt owed to the Fed, which has increased dramatically over the last several years. Doug may remember the number off the top of his head. Then there's intergovernmental debt purely, and then there's debt owed to the public. The problem is the debt owed to the Fed. That's the one that basically scares me. It scares me to some degree because it can grow without bound almost if the Fed wants it to. There's no regulator. Eventually, the interest rates on these things have to match up. They have to. And interest rates, again, I'm no economist, but I'm just a little old pattern matcher, and this little old pattern matcher doesn't believe things can stay where they are now. I've often told economists, and I've told salesmen at Microsoft, that the best forecast is the one that Excel does when it draws lines through plots. Because for every economist that says high, there'll be another one that says low. And for every salesman that says optimistic, there'll be reality, which is less optimistic. And if you just look at the pattern of past, which is why I started USA Facts. I didn't want to listen to forecasts and blah, blah, blah. Just show me what's happened in the past. I take a look at that and I say, okay, we will have a problem. We will. I worry about it. I worry about the Fed's role in artificially at low interest rates increasing this problem. And I still feel like it's a problem I'm just passing on to my kids.
All right,
My kids may be okay with it, but there's going to be a whole lot of other people who have to also help pick up some of that tax burden.
So we just have a few more minutes. Doug, I suspect they're yours. What do you think?
So I can be very brief. I think Steve is right that ultimately we will have to cut federal government spending or raise tax revenue above what would happen under current law in order to close some of the gap between spending and revenues and keep federal debt from just moving on this huge upward takeoff. We can't do that indefinitely. And that's what I think is likely to happen if we don't make some change in policy. But I have argued in other contexts, and we'll say again here today, that that problem is not nearly as urgent as it has appeared to me to be for much of my professional life, because interest rates are so low. Lower rates mean that the government can borrow more, but also it turns out to mean, according to most analyses, that the government should borrow more than otherwise. Again, that does not mean it can borrow an infinite amount, but it does mean that the problem is less urgent than it was. And that gives us a little more room, in my judgment, to address other urgent problems that we have in the country. And for example, we do need to do more for our children, or for children in the country, not my children maybe, or Steve's children, or your children, Wendy, for children in the country. But there are different ways to help those children. Part of the way we can help them is to provide broader educational opportunities, beginning at birth, essentially, so that those kids have a better shot in their lives. And there's a growing body of economic evidence that at least some of the programs that provide for children in poor families are good, not just for the children when they're children in those families, but actually give them a better leg up in the labor market when they go to work later in their lives. And so we need to worry about kids, but in various ways. One of which is thinking about the overall government debt problem, but also about making investments in their future more directly. I can stop there.
I just want to make one point, and it gets to the stimulus. It's the point Doug's making. The problem in government is you can believe there's no scarcity. Federal things at the federal government. Something is scarce. Tax revenue is not infinite. Debt can't be infinite. Spending can't be infinite. And because of the ways in which debt can be incurred or stimulus packages can be passed, it's not just about the debt or just about the amount of spending. It's about the level of prioritization. There needs to be a prioritization process, which in every other part of the world, in business and state and local government, is dealt with by some sense of scarcity. And right now in these stimulus efforts, particularly with the short-term nature, giving even a greater cover to not exercising scarcity, whether it's the debt long-term. Number one thing I would say, if I could spend more money, I would spend exactly in the area Doug said, and I would spend on preschool, frankly, and I'd make sure every kid in America could afford to go to a preschool. But without scarcity, then we tempt waste and some of the other things I know PRAC's going to look into, and I'll give a plug. I'm hoping the folks at PRAC do their job very well, And I hope at least we get great learning as we go forward so we don't live in a world with no scarcity that leads to waste.
An excellent note to end on. I personally have found this conversation incredibly interesting, and I have absolutely no doubt that the listeners did as well. So thank you both very much. And I don't know who I turn it over to now, but I know I turn it over to somebody.
I'll take it, Wendy. Thank you.
Excellent.
Thanks all.
Thank you.
Great. And thank you to our panel for another incredibly insightful discussion. Our speakers, Dr. Edelberg, Mr. Balmer, Dr. Elmendorf. To close out our event today, we have remarks from Representative James Clyburn of South Carolina, who chairs the House Select Committee on the Coronavirus Crisis.
Thank you very much for inviting me to participate in this event. It has been 1 year since Congress created the Pandemic Response Accountability Committee, or PRAC, in the CARES Act, and charged it with promoting transparency and oversight of the trillions of dollars allocated to respond to this national emergency. Shortly thereafter, the House established the Select Subcommittee on the Coronavirus Crisis, of which I have the honor of serving as chair. Modeled after the Truman Committee that was created during World War II, our mission is to conduct a full and complete investigation of issues related to the pandemic. Since our creation, the Select Subcommittee has been singularly focused on ensuring that our response to this pandemic is effective, efficient, and equitable. The Select Subcommittee could not have been successful without the invaluable contributions of the PRAC and the Inspectors General community. Over the past year, the Select Subcommittee has referred multiple matters to Inspectors General. Earlier this month, the SBA IG completed its review of duplicate PPP loans as requested by the subcommittee and published a report that confirmed and expanded on the subcommittee's previous findings that billions of dollars in PPP loans insured by the prior administration may have been diverted to fraud, waste, and abuse. This afternoon, we will be holding a hearing to examine efforts to root out these and other instances of potential fraud in small business lending programs. The American people deserve to know how their taxpayer dollars are being spent and whether their government is doing all they can to protect them from the coronavirus pandemic. Oversight from Congress and from the IG community is essential to that effort. That is why I'm encouraged by the Biden-Harris administration's pledge to support the IG community and protect their independence. And thanks to aggressive action by this administration to ramp up vaccines and Congress's historic enactment of the American Rescue Plan, the post-pandemic future is in sight. Thank you for your continued work. Together, we will help our country emerge stronger from this crisis.
Thank you, Chairman Clyburn. We reached the conclusion of our discussion of the CARES Act 1 year later, Oversight of America's Investment in Pandemic Response. I'd like to close our session by thanking our speakers and panelists and offering a special shout out to Lisa Rayula and Linda Miller of the PRAC and Ginny Hill and Regina Para of the Partnership for Public Service. The recording of today's event will be posted to the PRAC's website and on YouTube, so please follow our social media and share this event. To stay up to date on the work of the PRAC, please visit pandemicoversight.gov. And for information on the work of the partnership, visit ourpublicservice.org. We hope you'll stay engaged with us to continue these important conversations. Thank you and good day.